If you've been scrolling hip mobility and hip pain videos, this is probably the most important video that you're going to watch. If you're low IQ and you just like those clickbaity 5-second videos, scroll on by now. But if you're smart and you want to hear the truth about hips, stay tuned and let's talk about it in more detail. My name is Declan Judge. I'm a clinical specialist physiotherapist with 20 years experience. My friend and colleague, Dr. Josh Williamson, tagged me in a post recently where his followers were asking for the best hip mobility advice. Now, as Josh rightly points out, there are 6 main movements of the hip: flexion, extension, abduction and adduction. Add to that external rotation and internal rotation. So working range of motion for those 6 movements, in theory, should be a really good idea. The more that we move a joint and the more movement control that we have, in theory, the better our hips should feel. But there are so many caveats to that. The biggest problem of all is that the videos that you are consuming are so limited. They are clickbait because the average human attention span online these days is less than 1 second. So anyone who can stay tuned for longer than a few seconds, there's more detail to hip mobility than what you're seeing on these stupid biomechanical videos. Let me explain. So in theory, if we start to work deeper and deeper into those 6 movements, we should have improved hip mobility. That doesn't guarantee that that's a good thing. Our diets, our lifestyles, our sports, the nature of whether we have other risk factors like diseases, like autoimmune diseases, all of these things are relevant as to why some people have differing degrees of hip stiffness and pain than others. There isn't a simple fix for all of these millions, billions of people. On top of that, our hip shape is vastly different from person to person. The geometry, the mathematical sizes and orientations of the hip are different from person to person. This means that there is not a singular biomechanical model for all hips. So when a video goes out to 300 million people and 12 people in the comments are saying, oh, this is a great video and this worked for me, there are so many other people that not only did it not work for, it maybe made their hip pathology worse. The devil is in the detail, because those 6 movements, there are dozens of positions in which we could get those 6 movements to activate, and all of a sudden we're straight into hundreds of options. And if we combine the movements, a rotation and a flexion combined maybe, now we're up into the thousands, maybe even tens of thousands of functional choices, functional movements that hips can do. That 10-second video that give you that very specific fix, well, it's not going to cover the plethora of options that most people need to get through. Each person's journey is individual, it's specific. I always recommend working one-to-one with somebody, whether it's in person or online or both, who's taking you through a tailored program. Trial and error. The hardest part is starting, figuring out what kind of hip you have, what kind of hip pain and stiffness you have. And look, you're really not going to learn this from a TikTok reel or video. A really reputable clinician who genuinely knows what they're doing, who can be honest with you, that's a great starting point. That person can get you started on the journey to discover generally which types of movement, stretching, activation, control are good to work with, and maybe generally which ones to avoid for a while. And like any other training program, it's about gradual progression, progressive overload, graded exposure to the things that are either difficult or sore, and you look for the body to adapt over time. This is taking more than 10 seconds for me to explain, but it's one of the most fundamental things that good clinicians know about dealing with hip rehabilitation. Even when it comes to strengthening. The last few videos that I was sent this morning by people about hip strengthening, you had, I'll use my kind words, you had people who don't know what they're talking about. Activating hips in incredibly specific positions for specific times and specific reps, and that cannot possibly apply to all of you. It's going to apply to the most minuscule number of people in a similar situation, and billions of other people it's absolutely no use. So you have to be willing to learn and think about it and start on your own journey. Even when it comes to strengthening work, we have isometric work, we have concentric eccentric work, we have holistic and plyometric work. On top of all of the different movement strategies that I named before, to be able to strengthen your hip through these movements, we have gone into many, many thousands of options and choices. You're spoiled for choice. And I think that's part of the problem. I think people get stressed because they're spoiled for choice. And every video comes with conflicting information. Who do I listen to? Who do I trust? You just got to keep remembering one thing. There isn't a magic silver bullet. There isn't one thing that's going to sort your hip pain. It is going to be a jigsaw of multiple pieces. And when you start to get several of those going in the right direction, your hip's going to start getting better. But what those things are is different for everybody. Biomechanics are important. How the hip moves, how it functions, that is important. But a red flag for me are the people online whose videos are only about biomechanics. Hip pathology and hip pain relies on more than just the biomechanics. So, proper clinicians who have medical training, those people who can take into account your other health statuses, your medications and drugs that you're taking, the other risk factors that may be in your life, these are massively relevant for whether or not you're going to improve. So because everybody is different and context really matters and environment matters and general health matters, we have to start at least recognizing and accepting that and talking about it more. I spoke about morphology, which is that word for what shape your hip is. My final point on this video is going to be that you cannot change the shape of your hips. A lot of these online videos are trying to force people to do certain types of activity that their specific hips do not want to do. For example, if I combine hip flexion with hip internal rotation and adduction, I am going to come into a compressive force on the front of my hip. If my hip socket is quite shallow, I can probably deal with that compressive force. There's room on the front of my hip. But if my hip socket is very deep and overbearing, I may well get a pincer grip happening, like a pair of pliers, of bone against bone, the front of the socket against the front of the ball. Now, that's just one of many hip pathologies that can happen. It's one called femoroacetabular impingement, where your hip physically nips itself. And in advanced cases, it starts to cause physical bone damage and physical bone growth. One of the things that I commonly see is movement gurus trying to force people to grow their internal rotation when their bones are already at end of range. So what they're doing is nipping their bones harder together, and they're causing bone damage and bone pain. Eventually, if you really hammer into that bone-on-bone contact, you can cause significant damage, pain, and irritation to the hip. You may be accelerating yourself towards needing scans and maybe orthopedic interventions. So it's up to a good clinician to decide, are these movement strategies right for this hip? They could be wrong for this hip over here. Femoroacetabular impingement can come with loads of stiffness and tightness. So those billions of videos showing you about stretching your hip flexors, they don't take into account whether or not those hip flexors are weak, they're stiff, they're tight, whether there's a hip pathology underneath that's causing you to feel stiff, whether you have an inflammatory autoimmune disease that's causing your stiffness. They don't take into consideration anything. So you need to be skeptical when you're watching these videos. You need to take your specific hip off to see a talented and reputable clinician. You need to make sure that you're not causing yourself further damage to your hip through these movement guru videos, especially those ones that force internal rotation. You're welcome to reach out to me if you've got specific questions. I'm happy to reply to DMs. I've managed thousands of hips over the last 20 years, but most high-level clinicians will say that hips are complex. Hip rehabilitation is challenging. It is not something that is black and white contained within a 10-second TikTok. If the best clinicians all over the world invest a lot of time and effort and energy into helping each hip rehab get success. And that comes with trials and tribulations and then success. Well, then why should your issue be fixed in 10 seconds? It should not. So please be wary of people who want your attention, your clicks, your likes, and your comments. Thank you for listening. Here's a bonus round of extra information if you're interested. I'm going to take one of our 6 movements, abduction, and I'm going to use that as an example as to some things you can do. I'm going to give you a very, very basic framework as to how you might scale up, but still I'm giving you the warning that if you're really struggling with hip and groin related issues, go see somebody good. So abduction. Abduction. First, let me try to build my movement capacity over a few months. Now remember, if I increase my movement today, that's mostly a gift from your brain. Your nervous system can give you more movement today, but you cannot lengthen your ligaments and your tendons today. They take time to grow, months. So repeating an exercise multiple times per week over weeks and months is essential. It's up to you and your coach or your physiotherapist to decide what is the right dose. The Goldilocks zone. Not too much, not too little, just the right amount. Too little dose and we don't get any adaptation. Too much dose and we can get irritation of the joint, the capsule, the femoral nerve, whatever. So that Goldilocks zone is different for everybody, which is why I cannot commit to exactly 30-second stretch, exactly 3 reps, okay? You will have to fill in some of those blanks yourself along with the help of your physiotherapist or your coach. But as an example, abduction. I could grow my abduction thousands of different ways, but here's one way for me to do it. I could go into a Cossack squat, and now that abduction is being forced outwards. Or I could take a kneeling position, and I could force it out there, and I could work with my rib cage and my trunk to try and open the length of that. I could try those positions for prolonged seconds, or maybe just phase in and out of them. I could move on to my back using a slider, and I could start to use the floor for a sliding abduction, moving the hip out and back. All of these are abduction, and there are hundreds of other options that we could use. If I successfully grow my abduction, then beginning to strengthen the new movement that I have achieved. One of the best ways to begin is isometric, non-moving. Using an isometric contraction, I can start to condition any of the length change that I have achieved into sturdier, more robust tissue. Now there's so many ways to do that. I might do something like a modified Copenhagen. Activating my adductors, my groin, and squeezing on them. If that's too difficult, I could make it easier. I could scale it. I could move to my knee. I could make it a dynamic concentric movement. Something like a plate drag. Stepping and squeezing. Eventually, I could make that concentric eccentric. I could go to cable machine attachment, going through step and release to the cable machine or to the power band. Finally, I could work on more plyometric and ballistic movements, dynamic lateral hopping and skipping, or maybe even going to kicking drills, bringing a soft surface into play and being able to go into bounded kicks. All of these progressions would happen over weeks and months, not all in one session. The dose of reps, sets, and intensities, the volume of the workload, that's the devil in the detail. That's the thing that with your therapist or your coach or both, you start to, through trial and error, evolve the rehab program. And those are many options just for abduction, one of those 6 movements. So I always brief my patients at the beginning. It's a journey. There's a lot to get through. There's trial and error. The stuff that's too easy, we move on. The stuff that's too hard, we scale back.